Hi, I'm Debbie Gamble, and this is Everyday Trust. Trust is a big word. Trust unifies our families, our communities, and even the way we're governed. In a world of smartphones and screens, how we all build and maintain trust changes, and it changes fast. So I'm talking to people who are at the forefront of what trust means now. I'm excited to be talking today to Zayna Khayat. Zayna is a leader in the future of health. In fact, she was recently recognized as one of the top 10 women shaping the digital health landscape in Canada. She's the Vice President of Client Success and Growth at Teledoc Health, a global leader in virtual care. And before that, she was the future strategist at SE Health and led the Health System Innovation Platform at Mars Discovery District, the innovation hub in Toronto. Zayna also teaches health sector strategy at the Rotman School of Management. Zayna, thanks so much for taking the time to chat with me today.
Excited to do this with you, Debbie.
Me too. So let's kick off our conversation by defining some terms. What is healthcare at the most basic level, and what does trust mean in healthcare?
So before we define healthcare, let's define health. That's why we have healthcare. You know, health is what you are and what you can do for yourself. It's the result you want. It's you. It's not the absence of sickness, as we like to think. And so when do you do health care? Well, when you can't do health for yourself and you need to go to somebody else. You know, we talk about it means you're outsourcing your agency over your own health because, you know, you don't have the tools or the knowledge to take care of this very complex thing called the human body and mind. And so to link to your second question, Debbie, about, okay, then what does trust mean in this context of health care when you're outsourcing your agency? Trust is like the lubricant. When I think about trust, I think about three things that make it up: transparency, authenticity, and benevolence. Just knowing that who's giving you this care is doing it for the right reason and for good. And so this kind of trust in healthcare, it doesn't happen on one encounter, one visit to a hospital or a pharmacy. It's really built over time with fidelity and consistency. So I know, Debbie, you've been at this for a while. How does that framing of trust compare to other sectors? Are we way out to lunch out here in healthcare?
No, not at all. I think it's kind of interesting how you could probably apply those three very important factors to pretty much any industry. But I think the importance of those 3 points resonate across sectors. So, you know, when you started with transparency, and certainly in my world of payments and identity and security, transparency is all about can I see what's happening in a way that allows me to feel comfortable, confident, and maintain a sense of control. Authenticity is incredibly important. You know, not only from the perspective of ensuring any engagement, digital or even analog, is authentic, but certainly in the digital realm it becomes even more important to ensure that you can trust who you believe you are engaging with. And benevolence, you know, certainly, are you looking out for me? And in my world, that is probably characterized more in a way of, are you ensuring that my interests are a priority and are relevant to my needs? So I think those three factors that you highlighted are incredibly important, regardless of the industry, but it certainly resonates as it relates to health. So let's kind of think about trust from two perspectives, the challenges and the opportunities. So the first one, from, I guess, the weakest link, where is trust in the healthcare industry weakest?
I mean, if you think about all the points where trust can be created or destroyed and broken, you know, there are millions of interactions a day in this country alone. And in any business, you can break it in one interaction. So, let's unpack a couple of the areas. On transparency, there is a massive information asymmetry. We don't really know why decisions are made about our therapies, our tests. Our results are held from us, right? There's a strong belief to this day from clinicians that we can't handle our own data about our own body. And we're not really given choices or alternatives to optimize decisions about our health for our situation. We're given what works for the average, which actually means it doesn't work for anybody. And then, just on benevolence, if you think about it, healthcare is going through what I call a Copernican shift. Well, our healthcare system was designed around the system, around the payers, around the buildings, around the clinicians. Well, the center should be the patient. That's why we have healthcare. So we're in the middle of this major Copernican shift. That's going to be a source of creating trust in the future, but wow, has it broken trust. And then the second area where we've broken trust is a little bit more pointed, and that's many populations that have been marginalized and have learned to have a growing distrust of healthcare providers and systems, our Indigenous communities, Black and other racialized communities, LGBTQ, particularly right now, there's so much data on people going through a transition where the medical establishment is actively asking them not to proceed with what they're trying to do because that's their own biases. Anyone with low health literacy or language barriers. So these are major places where trust is broken. I actually think what's coming around the corner is going to help us quickly close that trust gap.
I agree. And again, it's interesting, regardless of the sector, those points, they resonate. So, consumer, customer-centric design, of course, the customer has to be at the center. But the notion of the importance of inclusivity is key here, right? So we all know that the more inclusive the design, the better the outcome will be. So even in the payments world, this is incredibly important to us. And it's this notion of digital engagement is going to be front and center to help address the inclusion challenge. So let's move on to that topic of our digital reality, and I want to talk a little bit more about healthcare in our increasingly digital world. Before we do that, though, I guess a basic question is why does healthcare need to go digital?
Pick a study, that racks and stacks any global core sector of how much has it digitized to date against how much does it have to go of what can be digitized. Healthcare tops them all. We're more behind than construction, agriculture, mining, like these extremely asset-intensive industries. And so, in that context, why digital? I think of three main reasons that have been the obsession of all of us in digital health for about 30 years. One is absolutely just, let's call it affordability or fiscal sustainability in healthcare. When 90% of your care is labor and there's just no way, because care is growing, demand is growing exponentially, and you can't add enough people, buildings, and beds exponentially. It's a linear industrial model. So we're just so behind in digitizing all our analog processes and infrastructure. Most studies estimate 25 to 40%. And those are big numbers. 25 to 40% of everything we do in healthcare today is either wasteful, duplicative, unnecessary, or harmful. So Debbie, imagine you were running a business and 40% of your delivery was inefficient. You would be out of business. While we're asking our healthcare providers to do, 1, 3, 6 hours of computer work a day. Documentation before the shift, after the shift, during the shift. So a lot of those cognitive tasks of healthcare, that a machine can do better, smarter, faster, cheaper, can start to shift, and you free up the human to be human. And why you need humans in healthcare, and you will always need them. It's fundamentally a people industry. Number two, once you've digitized, now you've got an intelligence layer of healthcare. Every transaction, every action produces data that has secondary use. You know this in every other industry. We don't know about this in healthcare. So we get better clinical outcomes, much smarter investments, and you actually can create like an ROI calculator in near real time. And we've never had that in healthcare. So I always say we move from an evidence-based healthcare system, or even I would suggest we have a reimbursement-based healthcare system. We only do what gets reimbursed, to an intelligence-based healthcare system. Number 3, which is what I get excited about as a futurist, is digital allows us to do things we simply can't do in the analog channel. And like a reminder, we've been doing it analog for 150 years. So we're talking about some amazing new opportunities, but wow, are we disentangling some very locked in institutional mindsets. So that way we can deal with inequitable access. We can deal with resilience to shocks like COVID, right? Like we had big supply demand imbalances in COVID of PPE and vents and people and vaccines. Well, when digital kind of distributes that. And then most importantly, we can evolve our care models to keep up with the times. And we haven't been able to do that. We're going to democratize access and overcome a lot of barriers in the analog channel on, inclusion, cultural norms, language, all those things digital takes care of. Forget the clinicians, but us as consumers or patients, as you've said, we'll have a lot more control, more agency, at least joint decision making over what's done about our body and health.
This seems pretty obvious, right? So both from the kind of operational efficiencies that you mentioned, to inclusivity, to the intelligence, just that intelligence of, okay, how can we continually optimize, continually improve, and put the controls in Canadians' hands to, back to managing their own health. And the way technology and digitization can truly change the way we go about our day-to-day and our environment. As Canadians, we're an aging workforce. There are many opportunities here, and this is so important to the future prosperity of Canada.
I couldn't agree more, Debbie, and I see what Japan's doing, what Germany's doing, even England, Australia, China, in seeing this lever of digital health as a fundamental value creator for society and for the economy. And then I look at Canada and we're just not seeing it that way and framing it that way. And so I really see a big opportunity there that we're missing out on.
So maybe we need to join forces, Zayna, and make sure that some of these opportunities are acknowledged, recognized, and addressed. Let's think about, okay, so what happens when the healthcare industry goes digital? What does that look like?
So every jurisdiction in the world is going through this digitization. We're all at different maturity models. I'd say the most advanced I've seen in the world as a country would be Estonia. There's a whole mindset there, but others. And we're very early at this journey. If we talk about digitizing healthcare, we're at like dig in Canadian healthcare. So the first step of what it looks like is, as we've talked about, just digitizing the most basic analog processes, like, Debbie, forms. I did my vaccine the other day at my local pharmacy. The whole setup was digital. I made my appointment, I put my intake form online, showed up, then they gave me the clipboard with the pen, and I repeated all the same information that nobody's going to read. Like things like that. And that's everywhere, and we all can relate. And that'll get to that 25 to 40% inefficiency. And that's now getting into the second and the third buckets I talked about of, an intelligence-based system and digital allowing us to do things we cannot do. Analog. And I think about 5 big shifts. One, it'll move from being reactive sick care to being not just proactive, but predictive. There's an entire new practice of medicine emerging called predictive medicine or predictalytics. And some health systems like Clalit in Israel, they have all the data, 20 years from womb to tomb or birth to death. They can predict you're going to have kidney failure. They can predict when you're going to have a schizophrenic episode and reallocate the healthcare resources to actually stop it from happening instead of mopping up the mess when you've got symptoms. So that's going to be a game changer, predictive medicine. The second shift is kind of healthcare today is episodic and intermittent. That will all shift to being from episodic to being continuous, to being much more integrated and kind of what we call whole person. You will not be the sum of diseases and body parts and treated that way and, be expected as a patient to stitch it all together. The third shift is from this kind of very crude, one size fits all paradigm to hyper personalized and very tailored, very configured, pick a word. And we think about personalized medicine. That's a very popular word. And we obsess about like your genetics predicting if a drug will or won't work. That to me is a minor use case of personalization. Personalization might mean, Debbie prefers to access her care while at home because she can't drive 4 hours and prefers to engage in a different language. That's personalization, in my opinion. But sometimes it could be your biology as well, and science is getting amazing there. The fourth shift quickly is the modality or location, or in the retail world, we'll say channel. Yep. We have mono-channel for 150 years called you come to the clinic, you come to the hospital, you go to the lab, you go to the pharmacy. Just like there's no more retail banks or very few, or you rarely will go to the mall to shop, that decentralization will come to healthcare to really, a kind of a care everywhere. That's going to be a big deal for a lot of physical assets that we've built over time. And then the final shift, Debbie, what does it look like with digital? And to me, this enables all the others, is the business model can change. We've had one business model for 150 years. I don't know a single industry that hasn't evolved its business model except us, which is a fee for service. Pay for inputs, activities, pay by the pill, by the visit, by the MRI test. And we can finally shift to fee for health. And that is going to unlock a ton of value.
That's a key element of innovation, right? Is changing the model, changing the paradigm. Lots of people think about innovation as technology, which it is, but there are many things that can be innovated to be able to really change that experience. I think, though, one of the things that is super important, and certainly in my world, and it sounds like it is also very applicable in the healthcare world, is relevance. So that hyper-personalized engagement model, as you say, it might just be because, I have a particular desire or preference around not traveling. It might be because I actually have a complicated set of medication that needs to be taken in a particular way. But, how can we, as innovators, as futurists like yourself, as working with technology and some fabulous capabilities out there, remove all of the friction and make that experience not just richer, not just a better business model, but more relevant and a better experience for the customer, for the patient.
That's my life's work.
I think this is where our worlds collide, right? Is that kind of how can you reimagine that experience in a way that's intuitive and in a way that gets us all to that kind of end goal, as we said earlier, which is, health and prosperity for Canadians. Which I think is the goal.
And I do want to pick up, though, you mentioned, verification and that aspect of, authenticity and cyber trust, if you will. Tell me a bit about, you do this, your industry for a living. How do you see that help fitting in with these shifts I talked about in digital health?
I think the notion of being able to deliver a simple experience, a simple engagement to a customer, to a patient in the healthcare world, where that patient can engage and feel confident that they can log in. They don't have to worry about personal details, that they're confident that there is a secure, simple engagement process, and they can then start to navigate whatever it is that they're trying to do, whether it's book an appointment, verify, a blood test, just do a regular health check. So the notion of whether you want to call it ID or verification or authentication is so critical for us to be able to engage in a digital reality. Whether it's, digitizing a form so somebody doesn't have to collect it, key it in, verify it. If you can do that in a very easy engagement to authenticate and verify who you are and you're engaging with the right person, then it actually removes all the friction, and we can move away from, some of the rhetoric around privacy and security, and actually just start to think about how we deliver better experiences, how we put control back into the hands of Canadians to manage their health, to have access to the data, to be able to, remember, did I get my 4th booster shot or not? Do I need to book an appointment without, the nightmare of trying to get through on the phone line to your doctor's office, which that just doesn't work for anybody. So I think, back to your point, all of this, the promise of these richer experiences really rely on fundamentally being able to provide that digital engagement first. So, we're already working at Interact with many of the service providers in the digital environment, both in the payment space, obviously, but in other sectors like the healthcare sector, to be able to do that, better business models, better business cases, but ultimately giving Canadians control of, and I love that term, control of their agency.
Debbie, I love that framing. So, a couple quick reactions. My mind's a little bit blown. One is the fact that our health system, is going to a trusted brand and set of capabilities like Interact to build these things, instead of what we love to do is build it all in-house ourselves, because it's not enough just to be amazing at medical care. We have to be great at cybersecurity and documentation and build these core competencies that are not core competencies. So I think that's going to go a long way. But secondly, the way you framed the value of verification, you didn't give me your technocrat. That's not the language we use. We talk about why you need to verify because we come from a place of risk, not to unlock this value from digital and healthcare. I just think it's a huge reframe that's sorely missing.
So there has to be a level of confidence and security in the engagement. And luckily for us, technology has allowed us to do that, whether that's kind of voice recognition, whether it's facial recognition. We do that every day buying a coffee using our phone. Right? So it's not like, and as Canadians, we've done this for years in the payment space, tapping your debit card at a point of sale. You don't think as a consumer, oh, how risky is that transaction? Because it works. It works the same way, and it works that way every time. And it's, what technologists do is they try to build in those capabilities to make sure that behavioral change can happen. And that's happened in many different industries. So it sounds like, we are at the right point to start to apply that to the healthcare industry.
So just maybe, though, to put a finer point, though, that said, given the amount of data generated in health is on an exponential curve, and depending on what report you read, Debbie. So I think a year ago, the number was that the healthcare data set globally is doubling every 18 months. The latest was 73 days. And I'm sure it's the same in every industry. We were never designed to process, manage anything, this amount of data, because everything we generated data-wise was largely analog for so many decades. So there is a long history, and maybe it's rightly placed, of what I call privacy panics. I just find the panics are based on not something actually happening. It's more what could happen. And I see every time, statements like when we see a new technology that can enable, let's say, an AI that can do all your upfront diagnosis before a doctor appointment, which is in the market in most countries. Here, people will say there's no chance in hell that will ever happen. Or no, we'll never share the data with the patient. You've just now tuned everybody out. So, just thinking about these, I don't know if you call them privacy panics. I'm sure they're not unique to healthcare.
What's our most important asset? Our health. So this is not trivial. It's super important, and our privacy goes hand in hand with that. At Interact, we've done a number of research activities, and in one of the recent surveys, over 60% of Canadians that we surveyed said that they care more about keeping their identity data safe than they did in the past. So it's a really important topic for us. But this is, I think, a lot about, well, how do we do that? How do we ensure that you can authenticate easily? How do we deliver confidence into the ecosystem? How do you ensure that those experiences work the way you expect it to work, the same way every time? That's how you change behavior. So I think there are definitely some learnings from the payment space that we are applying, whether that are, some technical terms like credential management and tokenization, where privacy and customer data is actually not shared. Given the vast changes that you see coming in healthcare, what do you think, what can we count on, and what will stay the same?
In the future, and I think this lends itself to what you do, whenever I get asked, I teach at the university, I get asked a lot from people who want me to mentor their children who are going to university, what are going to be the big jobs in healthcare? What don't we have enough? Other than obviously nurses and clinical, it's 3. Data and coding, we're going to need it like crazy in healthcare. Cybersecurity, we will not have the capacity given the data. And ethics, we are going to need ethicists and a way to have a conversation as a global species about what will be possible in health of humanity. And we don't have a framework at all. Like we need like the framework we have for climate change, where the world can have an approach, kinda. We're going to need that for a lot of things coming in healthcare, and we're nowhere close.
To your point, I mean, those 3 things are a constant, actually, regardless of industry also, right? Data, cyber, and ethics. And I think, I'm sure universities are all getting ready to teach programs around ethics, because it is going to be so important to every industry. I like to close off these discussions with a handful of rapid fire questions, if you're up for it. So, Zayna, if you could complete the sentence. Trust is just another word for?
In a healthcare context, we got your back when you need us.
Love it. The most trustworthy person I know is?
My mom.
And what's one thing an organization could do to quickly earn your trust?
Well, that's easy, Debbie. We're going to bring it back to where we started. One of these 3, transparency, benevolence, or authenticity.
Well, Zayna, it's been insightful, and thank you very much. This has been a great conversation.
Well, thank you too, Debbie. You've actually helped me think about my own industry very differently. So much value in analogous thinking, and so this platform is perfect for that.
Thanks, Zayna.